This is a diagram of some of the fibers that are staying on the same side or going on the crossing the midline, going to the opposite side. So this is the cortico-pontine tract coming from the cortex, going to the pons and crossing the midline, and this is through the middle cerebellar tract and goes to the cerebellar cortex. Olive sends information from both sides, so ipsilateral and also contralateral going to the cerebellar cortex, and that is sending motor information. The spinal cord, spinocerebellar tract, posterior, anterior, all of them are on the same side. The anterior one, if you remember, is crossing twice, but the rostral and cuniocerebellar is on the same side, so it's not shown here, but it means the same thing. So the anterior will go twice, but still on the same side, so that's what it means. And also coming from the vestibular nuclei, and this is on the same side. So these are afferent fibers. So if you look at this image, you can see the inferior cerebellar tract, middle cerebellar tract, and superior cerebellar tract. In the inferior, you have the posterior spinocerebellar and cuniocerebellar tract that is going upward. This is ascending and it's passing through the inferior cerebellar tract and going to the anterior lobe. Another one that you can see, this is the anterior spinocerebellar tract that goes all the way like this, and that goes through the superior cerebellar peduncle, and then it goes to anterior lobe. Another one is from pons, it goes to the cerebellum. So this is the pontocerebellar, and that crosses the midline. It goes through the middle cerebral tract and goes to the posterior lobe, so especially on the lateral area. Then is this one that is olive, so in the pons, so that is in the brainstem, and that goes to the in the medulla, that goes from there to the through the inferior cerebellar peduncle, and that goes to all three lobes. So the oculonodular lobe it goes, in the posterior lobe it goes, and also in the anterior lobe. So medulla is connected to all three parts of cerebellum through the olive. And also this is the vestibule that from here that passes through inferior cerebellar tract and it goes to the flocculonodular lobe. So that is for balance. The efferent fibers, some of them are staying on the same side, some of them are crossing. So this is the cerebellar cortex and the nuclei. Some of them are bilateral, some of them are crossing. So this one is in the red nucleus, so that goes to the midbrain. So on the same side also crosses the midline. From the red nucleus, that can go to the thalamus, so dentatorubro-thalamic tract is this one. Or it goes to from the cerebellar cortex and deep nuclei, that crosses the midline, it goes to the thalamus, and that is the dentator-to-thalamus tract, so that goes to the VA and VL nuclei of the thalamus. It sends information to vestibular nuclei, so this is the bilateral vestibular nuclei, but for olive it crosses the midline. So in the afferent it was receiving from both sides from olive, but in efferent it's crossing the midline going to the contralateral side. And if you look at the image here, so this is the flocculonodular lobe, and that sends information to the vestibular nuclei. So this is bilateral, and that is passing through the inferior cerebellar peduncle. The flocculonodular lobe sends information to some of the deep nuclei, EGF, and EGF also receive information from the vermis, and that sends information through the inferior cerebral peduncle to the olive, so that's the contralateral side. Also, that information is sent through the superior cerebellar peduncle to the red nucleus there in the midbrain. And dentate nucleus is receiving information from the anterior and also from the posterior lobe and process information, and through the superior cerebellar peduncle either goes to the red nucleus or it goes to the thalamus. So if it goes to the red nucleus, then it still goes to the thalamus, or it may go directly to the thalamus.